One of the biggest parts of the holidays for so many of us is the food this time of year, but also surging in popularity in 2023, Ozempic, the type 2 diabetes drug known for its effectiveness in helping users shed pounds. Well, now many users are considering skipping their injection in hopes of enjoying their favorite holiday treats. But is it a good idea or a safe idea to pause Ozempic in order to indulge in the season's offerings? Joining us live is Dr. Lola Adeyemo to share some safety precautions when it comes to using Ozempic during the holidays. Thanks so much for joining us tonight, doctor.
Thank you for having me.
So if you have a patient who is on Ozempic and says, hey, I want to pause it, I want to enjoy holiday food and then get back on it, what do you say?
That's a great question, and a question that I've been getting often, actually. And really, Ozempic and this entire class of medications called the GLP-1 agonists, they're meant to be used in individuals who are using it to improve their blood sugar if they have diabetes, or people who are overweight or obese who are trying to lose weight. And because this class of medication is treating chronic diseases like obesity, they are really meant to be taken weekly and continuously, not meant to be taken as desired, really. Because
Understood.
they're, yeah.
Understood. And so it's not meant to be taken that way, but what risks are we looking at if someone stops at cold turkey just for a couple of weeks or a month to indulge in some cookies and good food?
So that's a great question. So the risks really come on restarting the medication. With this class of medication, we're taking it weekly and doses are adjusted monthly, in effect, to get our bodies adjusted to this dose. So if you've been off of this medication for more than about 2 weeks, there is a possibility on restarting it, especially if you're at a higher dose. You're increasing your risk of having side effects such as nausea, vomiting, diarrhea, constipation. And if you do choose to take a pause in the medication, you really do need to talk to the provider who prescribed the medication for you about a plan for restarting the medication.
And so this is certainly not something you think someone should be doing on their own.
Definitely not when it comes to restarting the medication. You definitely need to talk to your provider just to make sure you're taking it in a safe manner. Because, and then the other thing that you really want to consider is that sometimes if you've been off the medication for long enough, you would have to restart at the lower dose, and that might delay you achieving your health or weight loss goals as well.
Okay, I appreciate that. It is so hard for most of us not to indulge in holiday goodies. Are there any food cravings in particular that Ozempic users should avoid?
There's not specific food cravings that you have to avoid. In reality, when you're taking this class of medications, what we recommend is just trying to follow a healthy diet generally. I mentioned the side effects like nausea, vomiting, and those side effects can happen when we're eating a lot of fatty foods as well, even if we're not taking this class of medications. So I would say, if anything, when we're eating these types of food, pay close attention, but generally just try to make healthy, mindful, portion controlled choices to try to avoid these side effects rather than skipping the medication.
Yeah, and it's interesting. This medication does seem to hijack, the sense of hunger for so many of these patients. So they're having smaller meals less often, and then if they go off of it cold turkey and they start indulging in these really big, high sugar, high fat meals, is that hard on the body in some ways as well, in some of our organs? And how quickly can users expect to gain the weight back if they stop taking Ozempic and start indulging so much so fast?
Yeah, it's a great question. So the real concern comes in those who have diabetes and maybe are obese as well and taking these medications, because those high carbohydrate, high fat foods that are common during the holidays that we want to indulge in, they can really spike our blood sugar. And coming off of a medication like Ozempic in the class of GLP-1 agonists, you really risk your blood sugar being uncontrolled, and that can lead to some short-term and long-term significant negative health effects.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.